The United Nations International Children's Fund has warned that the outbreak of cholera in Hammanskraal should be a wake-up call. 2 children are among the 15 people who have died from the waterborne disease. Unicef says the outbreak is a threat to the health of everyone in the affected areas. As a result, the fund is now ready to lend a helping hand to the health department. Let's find out more. We speak now to Muriel Mafico, Deputy Representative for Unicef South Africa. Thank you very much for joining us this evening. Can you tell us first off what the picture looks like at the moment globally and what makes the current global cholera situation unprecedented?
So in 2023, we are talking at the moment about 25 countries across the globe that have already declared outbreaks of cholera. And this is a huge number by any standard. It is a big number. We are also seeing, based on the analysis that is available, about 22 additional countries worldwide are at risk of declaring cholera outbreaks. So this is unprecedented, and it is actually coming on the back of a number of health emergencies that many countries, including South Africa, have been experiencing. We can mention the measles outbreak, which we were dealing with just a few months ago and are still dealing with. We are talking about even cases of diphtheria. We are also talking about the COVID-19, which we dealt with in the last few years. So we've really had a series of health emergencies in the region and across the globe.
When you say 25 countries globally have declared outbreak and 22 countries are on the verge of declaring outbreaks or are in danger of declaring outbreaks, and you say that that is extraordinarily high, give us some idea of what those numbers usually look like and what could possibly be leading to the current situation.
In terms of what is leading to the current situation, we can talk about the issues are related to access to water and sanitation, because when you look at where does cholera occur, where do we get outbreaks? It is typically in communities, in neighborhoods where you have poor access to water and sanitation. It's generally linked also with poverty in terms of access to basic social services. Now, when we talk about the unprecedented nature of the current cholera outbreak, it's really about the number of countries that are affected, the fact that in many regions in the Middle East, we have countries like Syria that are also battling with cholera. Here in this region, we have countries like Malawi, like Mozambique, like Zimbabwe, which have also been dealing with cholera. So it's really the number of countries, the number of people who are affected, as well as the mortality that we are seeing in some of these countries. And that is why it is a matter of big concern to everybody.
So two children among the 15 people who've recently lost their lives in Hammanskraal. Can you just sketch a picture for us how children in these socioeconomically challenged areas are generally affected by cholera?
So children in neighborhoods such as Hammanskraal and other deprived neighborhoods, they generally experience poor access to water and sanitation. I think this has been documented and talked about many times. They also live in homesteads where maybe the well-being of the family is also compromised. So really the issue of access to basic social services, the issue of access to safe water and sanitation is absolutely critical. But we should not also underestimate the fact that we've come out of COVID and witnessed how even routine immunization has been compromised. So we are dealing with a range of health issues, including the impact of COVID on routine immunization, which we are beginning to see some of the effects of this impact on routine immunization in the last few years. So one of our messages when we are dealing with cholera is that, yes, we need to improve access to water and sanitation. We need to improve hygiene practices such as washing hands with soap and other hygiene measures, especially in food preparation, food storage, and among other things. But also, we underscore the importance of vaccination, because at the end of the day, we know that vaccination saves lives. So it is part and parcel of the message that we are taking to communities. And indeed, we are already doing this, working very closely with the Department of Health, with the provincial authorities, but also with other UN agencies, including the World Health Organization, which takes the lead when it comes to health emergencies.
So we've heard the MMC for Health in the area, various leaders who are trying to intervene in this situation in Hammanskraal saying that, obviously they're monitoring the situation, but that at this stage, they know about the 15 people who have passed away. They know about a number of people who are in hospital. But until people report either to a clinic or to a hospital or to health officials with having symptoms, there could be many, many more people affected by this outbreak that they do not know of yet. We also heard a community member earlier in a news story just a couple of minutes ago saying that they weren't aware that the water was the cause of their symptoms and that they thought it was food poisoning. So there's also a lack of awareness in many of these communities, despite the fact that, we seem to think that as soon as something is on mainstream media, everyone knows and, everyone is aware of the risks. What can Unicef South Africa do to try and upscale support during this outbreak, not only in terms of interventions, making sure people get immunized or immunize their children, but to just generally also help create awareness?
Absolutely correct. The issue of ensuring that communities, families have access to accurate information is at the core of our support as UNICEF. So our entry point when we have cholera outbreaks such as what we're experiencing now is to ensure that information which is correct is given to families, to communities. So part of our work includes dissemination of information, working with the Department of Health, working with local authorities and other partners on the ground. Another intervention includes just disseminating information about what is cholera. What are the symptoms of cholera? What can families do? So, for instance, some of the advice we are giving has to do with proper hand washing with soap. It has to do with boiling of water, especially water for drinking purposes. It has to do with continuing to promote breastfeeding, even in cases where the mother might be experiencing cholera, or indeed the child. We still promote good practices such as breastfeeding. Other interventions that we are involved in include providing basic supplies such as sanitizers, hand washing soap, bleach for treating water, just to make sure that the communities get immediate support, which helps them to access safe water and sanitation.
Thank you so much for speaking to us this evening. That is where we're going to have to leave it. Muriel Mafico, Deputy Representative for UNICEF South Africa, giving a sense of how they plan to intervene in the cholera outbreak in South Africa at the moment.